live on Facebook. We're dancing to music. We have intro music. The music you hear in the background. Okay. That's what they hear on the radio. They can't hear it on Facebook.
Oh, got
so
it.
they just think we dance to ourselves. It's all good.
It's all right.
Part of our charm.
Yeah.
Good morning,
cool
Rupp.
kids are doing it.
Yep.
Sure. Oh, here we go. Sure.
Good morning, everybody, and welcome to the 425 Show, your place to be for all things real estate and lifestyle related here on the East Side. I'm your host, Nicole Mangina, with Windermere Real Estate. I have been selling real estate here on the East Side for, 24 years now. And I love real estate, but my true passion is helping to share fun and interesting things that make this a great place to live. And so that's what we do each week. We've got great guests for you today, but first I wanted to give you a real estate update and just how it's all going, right? It's a different world right now. Got the coronavirus. Everybody's interested in knowing just how it affects everything. What I can tell you from a real estate standpoint is the market's still ticking along. I have had some sellers hold off putting their homes on the market for various reasons, whether they're worried about the market or, maybe they have immune issues and they don't necessarily want people in their homes. But what I can tell you is my buyers are out there in force. They are looking at things, every day I track how many listings come on the market and how many receive offers. Every day, the number of homes that receive offers is larger than the number of homes that come on the market.
Oh, wow.
I know, super indicative of a strong market. So it's still going. I would just say decide on what your own comfort level is with everything that we have going on right now. But from our home selling standpoint, are they selling quickly? Are buyers able to find good houses? The answer to all of those is yes. So if you have real estate questions, thinking about buying or selling, whether it's now or later in the year, I always invite you to reach out. You can find me via email, nicole@nicolemangina.com. There you go. Without further ado, I'm excited to introduce our guest today. We have Kat and Rachel with Every You Aesthetics. And I know, say that 10 times fast, aesthetics. In Bellevue today. Thanks for being here.
Thanks for having us.
Yeah,
I'm excited.
I'm excited. I've been to see you guys. You're amazing. So, like I said, this is what this half hour is all about, my favorite part of the week. So why don't you tell us a little bit about what Every You Aesthetics does and kind of how you got into it, because you came at it from a different angle.
We
did.
did.
Very different angle.
Yeah. So, first, generally speaking about us, we're an aesthetics medi-spa, a very small medi-spa. We're inside of a doctor's office, Belgrove OBGYN, actually. And we do everything from Botox, filler, facials. We do PRP procedures with hair restoration, injections, things of that nature. We also do feminine rejuvenation, which we'll talk about in a minute. But we're both registered nurses.
Yes, love that.
And we met at Overlake Hospital is where we became friends, and that's kind of how we moved into this. I'll let Rachel kind of jump in and tell
it was
that
actually,
story.
Jalen's my son's second birthday. Kat told me she was leaving Overlake, and I was like, well, where are you going? I'm gonna go learn to do Botox. Yeah. She's like, come with me. And so I said, okay. So we went to school in Arizona. We learned how to do Botox, filler, all that fun stuff down there. And while we were there, we heard about this awesome procedure called a Vivive device. And so we were like, well, what's that about? We're OB nurses. Being down in that region does not scare us. We're used to it. And so we came back and we kind of approached one of our doctors and said, would you be interested in letting us come into your practice and start our own business? And they said, sure. So we brought all the fun things to Belgrove, and that's kind of where we jumped off from.
I love it. So, and we're going to dive into this because I'm guessing a lot of people don't know
what a Vivive
is, but you will know at the
You're
end
about
of this.
to.
Yes,
I'll
so
teach you.
It's coming, people.
Yeah, exactly. The anticipation. But I really like that you were RNs first, and still are RNs.
We're
right?
still RNs.
That's a past thing.
Yeah.
But you come at all of this from a medical, and with skincare and the other things that we're going to talk about today. Because at least for me, I was just out of town for some girlfriends. If I go get a massage, I'm really just looking to relax and zone out. But if I'm doing something for my skin, I want it needs to do something.
Right.
Yeah.
Right.
And, trying to achieve some goal, whatever that might be, and that's where you come in.
Yeah.
At Every You Aesthetics.
And facial aesthetics it's an art for sure, but it's also a science. There's a ton of, especially with Botox, filler, things like that. It's all about anatomy on top of the art.
Exactly.
So you have to know where you are, what the muscles are, what the vasculature, the veins and arteries and stuff of the face, so
Mm-hmm.
you don't hurt someone, and also so you don't make them look crazy sauce.
Yeah.
You want someone to look
Right.
natural. You want it to be in the right area,
Uh-huh.
but you also want them to be safe. So
Exactly.
it's a good combo. But in between us, we do, we have 15 years of hospital nursing.
Yeah.
Yes.
It's crazy.
So
No, right?
yeah. So, and then, the bulk of which was in OBGYN. So, which is kind of why we gravitated towards this Vaviv device, which we were
Right.
talking about, which is it's a feminine rejuvenation device.
Okay.
So it's an internal treatment for stress incontinence,
Laxity.
laxity, which is looseness, which obviously can happen after childbirth or even after menopause, just the change in hormones, decreased lubrication, painful intercourse,
Sure.
decreased intensity or frequency of orgasm. So all
Got
of
it.
those things.
They can
It's-
come see you,
come see us.
and
yeah.
you
Yeah.
can help with all of that.
Yeah.
With all of that.
It's
And
a really go ahead.
Oh, I was going to say the device has been around for quite a while. It's kind of like 4 or 5 years here in the U.S., but it had been in Europe and Japan way before that. So
All the good stuff comes from there.
yeah, it's so true.
They get the good stuff first.
Yeah,
There you go.
So it has been around for a while. It's not some new fandangled thing that we just bought and we're like, ooh, try this, everyone.
Yeah.
Right.
There's
And
lots of studies behind it. Realself.com, which is what we refer a lot of our patients to go read on any sort of, would you say, like aesthetic. I mean,
Yeah, anything
literally
from plastic
anything.
surgery to vaginal rejuvenation
Yeah,
to
you can
Botox.
find it on there. I always encourage patients to go look at that, and it has like a 97% approval rating. So
Yeah, and it's all real patients that are
Got it.
screened with their actual patients who have
Yes.
actually had this done. So it's a cool thing to look at. But the fun thing about the Vaviv too is it's a one-time treatment. It's not painful. It takes about 25 minutes in office. And whether you're treating for incontinence or more of the sexual function, you kind of get both. It's a 2-for-1
you get
kind of
I
a deal,
love it.
which is awesome. And as OB nurses, it's a comfort area for us, and
Yes.
that's kind of why we wanted to be in an OBGYN office. We thought it was a more comfortable place for our patients. It's clean. You're not going into a mall or a strip mall or something like that and asking to do an internal procedure that just seemed, I don't know, I wouldn't do it.
Yes.
I wouldn't do it, so I'm not going to ask patients to do it.
Right.
So
It's funny that you brought that up. My husband and I were talking about there's all kinds of treatments out there for lots of different things.
all sorts of things.
Some of which are fairly invasive and done by people. I'm like, really? Are you qualified to do that? I'm sure you're highly intelligent, but okay, I want somebody with more training. So I
Right.
think, and again, if you're just tuning in today, we have Kat and Rachel with Every You Aesthetics. They're in Bellevue. You can find out all of the information on how to find them and book appointments on our website after the show, NicoleMangina.com/podcast. And your website is everyyouaesthetics.com,
Yes.
correct?
That's us.
All right. So you are RNs.
Yes.
So you are fully trained to do these. Right now we're talking
Absolutely.
about feminine rejuvenation.
Yep.
Yes.
And you're both just super down-to-earth gals, right? Which is
Yeah.
nice because everybody has their own level of comfort with this.
Absolutely. Yes.
A, just admitting it and owning up to it, and then B, going to see someone. So
Right.
you make it a very, like you said, safe,
Yes.
easy environment to go and figure stuff out.
Yeah, and it's funny that you said owning up to it because for how many years have we had, sexual function medicine and things, commercials for men, but nobody
Right.
wants to talk about, women.
Yeah.
We need it too.
We're the
we
ones
have
that
the
have the
babies.
babies.
Right.
We go through menopause.
Yeah.
We have the hormone craziness all through our lives,
Yes.
going up and down that affects everything, including intimate areas.
Yeah.
So
Exactly.
yeah, so it's
That was why we
important.
wanted to get into it, because we wanted women to be able to have something that could help them. We knew that there was stuff out there, just nobody wants to talk about it. We're
Right.
like, well, we'll talk about it.
We will
We're
absolutely
happy to
talk
talk about it. Come visit us. So.
Yeah, we're kind of iffy at parties because people are like, "What do you do?"
Oh,
well,
yeah.
let me tell
me
you.
tell you.
Grab a glass of
Many
wine.
things.
Here we go.
Maybe a
Get
shot.
comfy.
Yeah.
Yeah. A couple glasses of wine.
Whatever you're comfortable with.
But yeah, I think my husband like tries to hawk it now to people. He'll be
So
like, I
does
tell
mine.
people what you
Yeah.
do, and I say they should go see you. I'm like, great.
That's adorable.
Thanks for supporting
Awkward
us.
for whoever you're talking to, honey. But,
But,
That's great.
Yeah.
I think it's great that you are doing that because I think a lot of people benefit from it,
Yeah.
like you said.
absolutely.
So you've got that.
Yes. we
And
do have that.
then-
Yes.
What other kind of services do you do?
We do all sorts of fun stuff. It's funny because we're in an OBGYN office. People are like, oh, so you must only have female patients then. And
Right.
we actually don't. We have a fair
few
amount of male patients. It started as like husbands of the
Sure.
OBGYN patients that were in the lobby and would just kind of
Come in and see what we're
sneakily
doing.
come in.
Uh-huh.
Hey.
Like I'm
and
looking
now
for the
it's just-
bathroom and
right?
you
Yeah.
end up in
Oh,
another
weird.
room.
How did that Botox get in my face? And then it just kind of expanded for them. Them telling their friends, and it's gone from there. So we do a lot of. For men, we mostly do hair restoration with PRP, which is an all-natural hair restoration.
Right. And so what's PRP?
Thank you. I tend to talk and we talk.
That's
medical
okay.
terms, we forget.
I'm your translator.
There we go. You're good. You're good. So PRP is platelet-rich plasma, which is
Okay.
basically a component of your blood. It's the part of your blood that keeps you young and fresh, is how I
There's all
like to
sorts of good
explain it.
stuff. Fibroblasts.
It's
all
the
sorts
good
of
stuff. We call it liquid gold. Yep.
Mhm.
Orthopedics have been using it for years. They inject it into athletes' joints.
Oh, interesting.
Not even athletes anymore. Just us
Anyone.
normal folk as
Yeah.
well. We get
Yeah.
PRP in our joints. So it's all natural. We don't add anything to it. There's no chemicals. Basically, we dry your blood in the room. Your blood stays in the room in a centrifuge. It spins out. We pull out the platelet-rich plasma or the
Okay.
PRP. And
And
we
looks
inject
like
it.
gold.
It
It's
looks
like
like gold.
yellowish
I mean,
color.
it's
Yeah,
literally
it's
gold.
yellow.
Yep.
Oh,
Yeah.
funny.
We always show you like, look how pretty your PRP is.
I know. I have to admit,
Some
I'm
people
working
think
up
it's
to this
pretty.
one. It's a little
Yeah,
bit.
we're trying to talk her
But-
into it. So,
All right.
not the hair restoration though. We'll do it. We'll do
Well,
a
I got all
facial.
that. Yeah.
We don't need the hair restoration.
All
I
right.
got plenty of that. But anyway, so for hair restoration, we would inject it into the scalp, kind of in the problem areas. And what
Sure.
it does is it basically wakes up those follicles that have gone dormant over the
Okay.
years. You have to be a good candidate for it. If you're shiny bald, that's
You're probably
It's
sorry,
too
guys.
far. Those
Yeah.
follicles are gone.
You've gone
Yeah.
too far. But if you still have those follicles and they're still alive, they're just not growing anything, or
Sure.
they're only growing maybe one strand, you need some help.
If it's
to
starting
wake
to
those
thin,
up.
that's
Yeah,
the best time to start.
Yeah, absolutely.
Okay.
And it also stop your follicles that are currently healthy from tossing the hair that it has.
Okay.
So we've had really good results with that. Patients
Yeah.
are really happy
That's
with it. So
awesome.
we do a lot of that for men, and then some
Botox,
facials and
facials.
Botox. Yeah,
We
diamond
definitely
tip
have guys that
facials
like
are
diamond
really
tips.
Yeah.
popular. So
I know. So let's talk about your facials though, because
Okay.
you do more than just the little like I'm gonna steam you and throw a little
Right.
clay mask on
Right.
and call it good.
Yes.
I mean you
we do those. Not
Yeah.
us. Our esthetician,
Our esthetician does those.
Right.
But
Yes.
No, but you do the ones that actually like
the
get
medical
in there and,
facials.
Yeah.
Yes.
you know, get
Our
you some
diamond
results.
tip.
Yes.
So our diamond tip, or it's diamond glow now.
Yes, it
Because
changes.
Allergan
names.
bought it, which is great.
Okay, so then you
Allergan
get
owns
rewards
Botox.
points.
Yes,
you
you
get
do.
rewards points
Yeah.
now.
So
So
it's
Botox
great.
lovers.
Yeah.
See,
Botox
it is a
with
rabbit
the
hole
facial.
once you like go down this road.
Just
It's
keep
kind of
going.
fun though.
Yeah. So our diamond glow machine, we have 4 different serums to choose from, and it infuses, extracts. Oh, it's like a 4-letter thing. What is it?
Microdermabrasion. Oh.
Yeah. So it
Well, just
exfoliates,
microdermabrasion. Yeah.
extracts,
Yeah.
and infuses. That's what I
Mhm.
want to say. So the serum gets into your what they call the DEJ, so the dermal epidermal junction,
Okay.
meaning that it gets in real deep.
Yeah.
You go away looking. You've had one. I mean,
It's great.
right? You
I
go
was
away
gonna say, are
looking
you gonna call her
glowy.
out on that?
Yeah.
I will fully
She
admit.
came in and
I mean,
had
HIPAA.
one.
I don't
Yeah.
know. We just called you
Oh,
out.
that's
Well, she comes to see us for that. So,
Yeah.
but yeah, we have vitamin C, ultra hydrating, pore cleansing, and our
Skin brightening.
yeah, with the Lumixol. But it's a great facial. There's not a lot of downtime with it.
Yeah.
You go away looking great, like your skin gets that first layer kind of sloughed off. But you could totally get it before a big event, and you don't have to worry about looking like you had a facial.
Right,
Like
and
some of
it
those
is.
facial
It
ones out
feels
there.
really moisturizing because I've done just the dermabrasion before, which is great. But
Yeah.
it's like a super deep exfoliator, right?
Yep.
And then you add this part, and you can tell that that's happened.
Yeah,
We
you
get
get to
like
see
that
a
little
jar
glowy,
afterwards.
and yeah.
Mhm.
Yeah, and you
nice and
also all the
moisturized.
gunk that gets sucked out of your face gets put into a waste jar that you then get to look at the end of your facial. Be like, look, that was
Yeah.
in my face.
Exactly. That's yeah.
It's
Very
actually my
good.
favorite part.
And I know. Isn't that
It's my
funny? Once you
favorite.
start doing
It's
this,
so
stuff,
gross,
it is,
and I love it so much.
Yeah, you kind of can't help it. But
Yeah.
there you go. You can look or not look. Just know you'll look better.
Yeah.
You'll
and
look
that's
better.
the part that matters.
Yeah.
Yes.
So with that facial, we have our Aqua Gold, which we can do. It's 12 little tiny needles about the size of a strand of hair, and they're gold too, actually. And so we can put a mixture. We can do vitamins or filler and Botox, and it's just stamped all over your face, so it tightens everything, kind of makes your pores smaller. It's a great one to do before an event too. And then we have our microneedling with our awesome German microneedling device.
I love
That stuff is awesome.
German made, baby.
Yeah. And you can
There
do
you
it with,
go.
we have some different serums you can microneedle in, or we have PRP. So.
And what's the philosophy behind microneedling?
So microneedling is considered controlled injury. So
Okay.
basically, with our machine, we can not only control the depth of the needle, how deep it's going into your skin, but also how fast it's going in. So we
Okay.
can adjust that for things like deeper lines or acne scars, under
Sure.
the eyes, things like that. So you're causing these micro injuries, which turns on your body's healing response. So
Got
all
it.
the blood flow comes to the area, all those macrophages and fibroblasts come to the area and start building collagen and elastin. They plump the skin, they give you that rosy glow back again, and then it also just puts that collagen elastin building into hyperdrive. So what that does is it kind of smooths out fine lines, it plumps up deeper lines, and it tightens and tones the skin.
Yeah.
So
Perfect.
the cool thing about our device, which we were saying it was German made, it's the only one on the market that's surgical grade. Everything else is medical grade, which is great.
Sure.
Most things are medical
Yes.
grade. But surgical grade, the difference is as those needles are going in and out, in and out, in and out, because it's a pen, so it's automated. It kind of sounds like a tattoo gun if you've ever heard one of those before.
No, but okay.
I don't have any tattoos.
like a buzzer.
either, but
Me
it's a buzzer.
Yeah.
Yeah.
All right.
Anyway, but they're going really, really fast. And as they go in and out, needles tend to dull.
Right.
Surgical grade. All of them do. After a while, they start to dull. With this, since it's surgical grade, it doesn't dull.
Sure. Mm-hmm.
It's also sharper, which sounds scarier, but it's actually better. It makes it less painful, and you
Sure.
have less downtime. So you're
Okay.
not causing that surface damage, as it were,
Sure.
that gives you that bloody Kim
You don't go away
Kardashian on the
looking
internet
bloody.
look. No, that you don't go away looking bloody.
Yeah.
Because all of the micro injury is a little bit deeper in.
Okay.
So you kind of just look rosy pink, like you were in the
Yeah.
sun maybe a hint too long when you leave.
Sure.
Okay.
Okay.
So now our downtime went from 2-3 days after microneedling with PRP down to 2-3 hours for
Yeah.
most people.
Oh, that's fantastic.
Unless you really want us to attack you when we go super deep, then it might still be a day. But either way, it's not going to be
No.
3 days.
That's awesome. I think this is a really exciting field right now.
It is.
For years, it was like you got your little fluffy facial, or you kind of went under the knife and did the whole full-on
Right.
facelift, and there was not anything in between. And now there's all of these different things that you can do. That because we like to. Whether we're doing it for other people or ourselves, you want to take care of yourself. You want to feel
Absolutely.
good about how you look. And what I've found in my journey is there are different things that work for different people.
Oh, absolutely.
Because I know with some of these, I think really with all of them, but I have selective hearing, so I'm going to say with some of them, you're supposed to stay out of the sun.
Correct.
Right?
Yes.
I'm average at that. Part of that is I like the sun. The other part is I just have 2 boys that play baseball, so
Right.
I'm in the sun even
You
if
have
I
no
want
choice.
to. Right?
Yeah.
So some things are better for my skin right now than others
Yes.
based on that. And I'm assuming do you guys do, or gals, do consultations? The great thing is there's really good options out there for people, but sometimes it's a little overwhelming,
Oh,
right?
absolutely.
What's the right thing for me? And these are not inexpensive. They're
Correct.
worth the money. They
Yes.
work, but it's nice to come in and just find out, okay, here's what I've got going on. Here's my lifestyle.
Yeah.
What can I do going forward that's going to give me the best
Right.
results?
Yeah. Yeah.
We do free 20-minute consultations in office, and actually,
Perfect.
before you probably schedule anything, it's a great idea to come see one of us.
Yeah.
Just so we can talk through what your goals are.
Sure.
You might think, oh, I need this, and you come in and we chat, and maybe that's not the road you should go down. Maybe it's something else.
Right.
So, which you can book online at our website,
Perfect.
which makes it really convenient. It's everyouaesthetics.com.
Duh.
Yes.
There you go.
And you can go on there and book your free consultation and come see Kat or I, and we can chat about what your goals are, what you want to see. We have some awesome medical grade skincare in the office too, so we can talk about that. All sorts of fun stuff. But it's great to schedule a consultation and come in and talk. And you might go away with like something you didn't think you needed, and now you get to do. Maybe you came in, you thought, oh, I probably just need filler, and we're like, actually, no, you can do all
Actually,
these
no.
fun things instead.
Yeah.
So, yeah,
Exactly.
it's always good to just come in and chat with us.
Yeah, and figuring out your time commitment. Some things
Right.
are fun to do. It's like some things you do because they're fun, but some of these facials are nice too because you get some lasting power
Right.
out of them.
Or if you have a wedding in 2 weeks, probably not best to do something super invasive.
Right.
Right. But if you have a wedding coming up or a big event, we can kind of like work up to what your goals are.
Make a
If you
plan.
say,
Yeah.
I want to look this way for my wedding, then we can work up to that, or this way for this event. So,
Right.
yeah.
And we kind of err on the side of less is more too. We don't like to
Sure.
pump people
You're
full
great.
of things.
Yes.
Whether it be Botox filler or even invasive facials. Like we oftentimes we have patients thanking us for talking them out of things.
Yeah. Well, you were great the first time I came in for Botox. I do have Botox. Yeah, it's for real. Like, it's out there. It's on the internet now.
There's no taking it back. It's out there.
No, there you go. I fully admitted to it. But we weren't sure, right? Like, how much do you need? Well, I don't know. You tell me. And your comment was, well, let's start with this. Let's start a little bit lower.
Yep.
We can always add it.
Always add more.
But yeah, I really appreciated that. You were like, well, let's go this route, and then we can always add. And,
yeah, I mean, we don't want to waste people's time or money, or, you know, you don't want to put more things in your body than you need to be putting in your body also. So, you know, while we want to make you look good and we're not going to, you know, not going to turn you away, but we're not, well, we have turned people away. That was a lie. But,
that was fair.
That was a lie.
But we want you to
but we want you to look
your money.
good. Yeah.
Right.
Like a natural but refreshed
better
version of yourself.
you.
Yes.
Yeah. So we don't want you to look fake and done.
No.
Yes.
As it were. So.
Exactly. Well, and you do. Like I said, I'm a fan. I was out of town. Girls' weekends are fascinating, right? I was out of town.
Oh, yeah.
With
We get real deep with people.
Yeah, girls, and it was funny because there was a point where it came out like, you know, who's done what and this and that, and people were like, really, I never knew that about you.
It's like the adult version of Never Have I Ever.
And yes, it was really, and it just kind of happened, right? I don't know how we got on this topic, but it was really fun to like, oh, okay, well, maybe I'll try this. Or and there's a couple gals in the group that come and see you at Every U Aesthetics and had great things to say about your services and just that they've really enjoyed it. So, you know, this is great. You've got everything, right?
Mm-hmm. Yeah. We think we got all
Literally,
our bases. I mean, literally head to toe.
To toe.
And actually, literally to toe. Our diamond tip or diamond glow actually has a body hand piece. And so when it gets closer to summer, we have a lot of patients who have us do the microdermabrasion on their backs of their legs. And we can even do feet, which we don't do a lot, but we do a lot of backs of the legs and backs. You know, like men will come in and do backs, and it pulls everything.
Oh,
out
really?
of there too. Yeah, it's a larger hand piece that you don't have, you know, that tiny little facial hand piece going everywhere. But so literally head to toe.
Yes.
There you go.
We can help you out.
All right.
Yes. Yeah. We got you covered.
All right. Perfect. If you're just tuning in today, we have Kat and Rachel with Every U Aesthetics. They are in Bellevue. They're part of Belgrove OBGYN. You do skincare, but you also do feminine rejuvenation.
We do.
Which is a big thing. And I hope more people come and visit you for that, because it's one of those things that I think has been so underground for a while.
Absolutely.
And I think for women to realize, like, there can be other things. That was one of the other, when I was out of town with the girls this weekend, some of us went to a class and it was kind of on this topic, and that was what the gal was talking about. There's so many things we've just come to, like, attribute to, well, that's life after kids or life after a certain age.
Silence,
yeah.
right?
You know,
Like,
have to pee your pants after having a baby.
Yeah.
Right.
You don't
but
have
you
to.
just figure that, well, that's the way it goes.
Yeah.
I think there are even doctors that say that. I had a patient say she came to her doctor and said, you know, I'm going through menopause, this is what's going on. And she said, well, that's life. Welcome to the club.
That is
well, that's
kind of
rude.
But that's the general thought process, right? And to realize there might be some other options out there.
Tons of options,
that could make life, you know, a little more fun.
Way more fun.
Way more fun.
Yes.
And you don't have to suffer.
Exactly. So, and you are RNs, so
we are RNs,
100% know what you're talking about.
Yeah.
You have had your own children.
We have had our own rejuvenation procedures done to us.
There you
go.
So
we know each other very well now.
We've tested a lot of our own.
We've tested everything on ourselves. So
that's awesome.
You know. In fact, this weekend, Rachel's going to plasma pen my face. Have we told you about the plasma pen?
No, let's hear it. What's the plasma pen?
So plasma pen is fibroblast therapy. So it's basically it's controlled burns. We talked about controlled injury with the microneedling. Those are little puncture wounds. These are little tiny burns to the face, and what it does is it removes basically a burnt column of skin. That goes away. The skin around it kind of tightens around it. And then the intense heat, just like a laser facial, builds collagen and elastin over the next 3 months. So you get that initial kind of removal of some skin tightening, and then you get the extreme tightening over the next 3 months.
Got it.
It's amazing.
Yeah, it's pretty awesome.
What,
so
like,
fun.
Why would you come do that?
So,
who would be the perfect candidate for that?
A good candidate for that would be anyone with crepey skin.
Yeah.
So crepey meaning the thin kind of, it's kind of lost its elasticity.
Got it.
Sort of thin. We do a lot of under eyes because there's not a ton that can treat under eyes. We do PRP injections under there, but that's kind of a waiting game. You have to do multiple treatments. It will just kind of eliminate some of that excess skin and then tighten over the next 3 months. It's pretty magical. I'm going to do all right here because I have these little free gels here.
Do you
see them on Facebook? Do you see them?
They're not,
We're gonna do
that's
some
not
tightening
there.
right here.
You'll
But
get
you
it.
can do like bellies after.
Oh, yeah.
You know,
Oh, I
we
saw
all
that
get
on
that
your
little
website.
like boop, boop, boop after
Yeah.
having a baby. You know,
Right,
above your
they've
belly
stretched
button.
didn't quite go quite.
Yeah.
Yeah. So
Yeah.
kind of feels like a magic pen sometimes. It's not magic. It's little burns, but it
With
it
magical
looks like
results.
magic. Yeah. So the only downside to that is there is some downtime. You
Okay.
have these little tiny dots on your
Yes.
face or wherever. 5 to 10 days.
Well, right now we're all supposed to stay home and
Right.
Well,
so
now's
it's
the
the
perfect
perfect
time.
So I
Come
think-
get plasma pen.
Right.
You're not doing
Perfect
anything
time.
socially.
but only if you're healthy.
Yes, don't come
if you're not
here
healthy.
Um,
So yes, that's kind of a fun one that
Yeah.
Rachel's
You can do like brow lifts with it.
Mhm.
It's a great
Yeah.
option for people who aren't at the point where they need to have a blepharoplasty. And what that is where you go in and have your eyes like
yeah,
surgically cut.
done.
It's a great option for people who maybe don't want to go that step yet or
Mhm.
aren't really there, but they want to do something.
Mhm.
So,
Kind of just lifts the
Yeah.
eyelids off of your eyelashes a little
we can
bit.
treat
Yeah.
that. We can treat all sorts of things.
Great that there's so many non-surgical options out there
Yes.
now.
You don't have to go under the knife anymore. You
Yes.
can do so many more things before you actually have to be put under.
Yeah.
Yeah,
And a lot of
exactly.
people can, I think, probably avoid it altogether.
Yeah,
yeah.
If
most
you just,
people.
start early and take good, consistent care of yourself.
Yeah.
Absolutely. Yeah,
Awesome.
absolutely. So it's kind of fun. We got what else we got going on right now?
Oh,
IV therapy.
oh yeah.
Oh, hello.
Yay!
Yeah.
Speaking of everyone being sick, so we have vitamin IV therapy
Sure.
coming into our office. It actually starts this Saturday. It's
Yeah.
our first day that we're doing it. We're doing it on Saturdays, so we can take more patients at once. We have one
Sorry,
room.
One room wouldn't fit everyone. to
Yeah,
drip at
so
the
we
same
can, because people can
time.
drip, simultaneously. So it's really cool. It's we started with our immunity bag, which we thought was, perfect for right now.
Yes.
We were planning a summer rollout for our whole
Yeah.
menu, but people kept asking for it. So we're like, okay, well, we'll
Do
roll out
it.
one.
I like it.
So here it comes. So it's vitamin C, B12, B6,
B9.
B5,
And-
and then a B complex.
Yeah, it's like an
So,
IV
yes.
and just gives you a boost and
Yes,
Yeah.
it's mixed. We just mix the vitamins in a big bag of fluid, and then we have an IV nurse who's going to come and help us, and she'll get you all hooked up.
I love
and
doing that in the doctor's office. The whole strip Molly IV thing is just it gives me the heebie-jeebies. So that's awesome.
Yeah.
Cool.
Yeah. So that's what we
Great.
have
Well,
going on.
thanks for joining us today.
Thanks for
Thanks for
having
having
us.
us.
Yeah.
Fun.
Again, we've had Kat and Rachel with Every You Aesthetics. You can find them at everyuaesthetics.com, or we'll have links to all of their things on our website after the show, NicoleMangina.com/podcast. Thanks for listening, everybody, this week. Stay healthy, wash your hands, and we'll see you next Tuesday. Bye.
Bye.